Assalamualaikum warahmatullahi wabarakatuh. Hi everyone, my name is Indriani. In this video, I will discuss several important concepts in healthcare quality management, including transformation processes, quality characteristics, process variation, quality control tools, and the importance of data in healthcare quality improvement. A transformation process is the process of converting inputs into valuable outputs. In hospitals, healthcare workers, medicines, medical equipment, and patient data are transferred into safe and high-quality healthcare service. However, healthcare quality is not only measured by patient recovery outcomes, but also by how healthcare services are delivered. Many hospitals still focus too much on outcomes, such as recovery rates or accreditation results, while paying less attention to daily service processes. In fact, many patient safety incidents occur because of process failures, such as poor communication or delays in treatment. Therefore, national standards for hospital accreditation, or SNARS, emphasize patient-centered care and risk management. Process performance can be described through reliability, responsiveness, assurance, empathy, and tangible in the SERVQUAL concept. In hospital service, quality is not only about correct medical treatment, but also about patient experience during the service process. A doctor may be clinically competent, but poor communication can still reduce patient satisfaction. This shows that healthcare quality is multidimensional. Hospitals often focus on administrative indicators such as bed occupancy rates or BOR, or the number of patient visits, while patient experience is actually one of the most important indicators of quality. When patient expectations are not met, public trust in hospitals may decrease. Common cost variation refers to normal variations that come from the system itself, while special cost variation is caused by unusual or abnormal factors. For example, consistently long waiting times indicate systemic problems such as insufficient staff or inefficient workflows. In contrast, a hospital server failure that suddenly increases waiting times is considered a special case. Many healthcare organizations focus too much on blaming individuals without improving the system itself. Therefore, quality control should focus on process improvement rather than simply identifying who is at fault. Run diagrams are used to identify data trends over time, while control charts are used to determine whether process variations remain within statistical control limits. Both are used for database quality monitoring, but control charts are more effective because they can distinguish between normal and abnormal variations. In hospitals, these tools are important for monitoring infection rates, medication errors, patient waiting times, and hand hygiene compliance. However, many hospitals collect large amounts of data without properly using them for quality improvement. Because averages alone are not enough to describe process quality, the mean curve shows the average result, while the range curve shows the stability and variability of the process. For example, the average emergency department waiting time might appear acceptable, but if the variation is too large, the service process is actually unstable. In healthcare service, consistency is very important because it directly affects patient safety. Inspections only identifies errors after they occur, while the true quality should be built into the process from the beginning. Therefore, modern quality assurance focuses more on prevention than on final inspection. But SNARS and GCI emphasize patient safety, culture, and continuous improvement. However, some hospitals only focus on quality before accreditation surveys. This shows that quality is still viewed as an administrative obligation rather than an organizational culture. Healthcare quality strongly depends on data quality. Inaccurate data can lead to incorrect decisions and may endanger patients. In hospitals, data are used for quality evaluation, patient safety, infection control, and management decision making. However, data manipulation and underreporting are still serious problems because hospitals often fear damaging their reputations. The difference is variable data is numerical data that can be measured, such as blood pressure or patient waiting time, while attribute data is categorical or count-based data, such as the presence or absence of inspection or the number of patient falls. That concludes my presentation on transformation processes, quality characteristics, process variation, quality control tools, and the importance of data in healthcare quality improvement. I hope this discussion provides a better understanding of the importance of process-based and data-driven approaches in achieving high-quality healthcare service and patient safety. Thank you. Wassalamualaikum warahmatullahi wabarakatuh.